The following portion of Studio 512 is sponsored by Austin Spine. Issues in your back can affect your whole body, including daily movement. Here to talk to us about a common condition, scoliosis, and how to treat it are Dr. Craig Kuntz and Dr. Rick Wupperman with Austin Spine. Dr. Wupperman, we're going to start with you. What exactly is scoliosis and how is it diagnosed?
Yeah, scoliosis is commonly referred to as curvature of the spine. All spines curve to some degree, but spines that curve unnaturally or abnormally are considered scoliosis. So there are various kinds, including adult scoliosis and adolescent scoliosis. For adults, it's commonly first encountered because they have symptoms like pain in their back, pain in their legs, pain in their arms. So often they go to doctors for symptoms and get X-rays, which show a curvature.
Okay, yeah, a couple different ways to get diagnosed, just since it can apply to so many different times of your life. Dr. Kuntz, I want to ask about early detection, especially when we're talking about kids. How important is it for a good prognosis?
That's a really important thing to do, is to try and find this kind of early. If you find it early, you can do a lot of non-operative treatments and get ahead of it. If you find it too late, the curves often get too stiff and too great in magnitude, and then they may not be amenable to bracing and non-operative care.
Talk to me about the progression of something like scoliosis. What are some of the negative outcomes if someone doesn't get in and start treatment?
The biggest problem is that people are going to have pain and potentially disability that we can't fix. We'd like to be able to get to them and try to take the pressure off their nerves early if they need to from a surgical perspective, or try and get them the non-operative care that maximizes their functional capacity and keeps them out of the operating room. So both things are very important to try and get to them earlier. The biggest thing we see, particularly in adults, is that they're just less active. So they often compromise their health. They're not doing all the things they need to do. You have to be able to walk and function and socialize, and a lot of people just give up on a lot of those things. So it's better to be treated and try and avoid some of those sort of downsides of life that hit you in all different ways.
All right, and Dr. Kuntz, are there any new treatments or technologies available? I know you're pretty jazzed about some of these.
Yes, I'm glad you asked, because we happen to be the only center now that has the EOS Edge in Central Texas. And it's really a fundamental tool for treating scoliosis at sort of a higher end. And luckily we have that. We've been backed by a great hospital system, St. David's, and we have that capacity. And what it really does is it allows us to image people from head to toe, less radiation, and there's a lot more resolution. So it allows us to see things early, see things better, and then do better planning, and then hopefully execution.
Sounds good to me. Doctors, thank you for your expertise today. We appreciate it.
Great, thank you.
Austin Spine is located adjacent to St. David's Medical Center in Central Austin. Learn more at austinspinesurgery.com. The preceding portion of Studio 512 is sponsored by Austin Spine.